From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to today's JAMA Author Podcast. I'm Dr. Linda Brubaker, Deputy Editor at JAMA, and today I'm joined by one of our esteemed authors, Karen Schliep, a PhD who's an Associate Professor in the Division of Public Health, Department of Family and Preventive Medicine at the University of Utah in Salt Lake. Welcome, Karen.
Thank you.
Well, we know there are well-known complications and morbidities of endometriosis, commonly including pelvic pain and infertility, and that there are three endometriosis macrophenotypic subtypes: superficial peritoneal endometriosis, ovarian endometriomas, and deep infiltrating endometriosis. Prior studies have suggested associations with ovarian, breast, and endometrial cancers in individuals with endometriosis. In the JAMA study you and your co-authors contributed, you focused on ovarian cancer, a very serious cancer that often presents in late stages. The manuscript describes the analysis of how endometriosis subtypes influence ovarian cancer risk, both overall and by histotype. Why did you do this study now?
Well, we know with endometriosis, the gold standard diagnosis is visualized disease. And since 1997, the American Society for Reproductive Medicine has used a staging system, stage 1 through 4, mild, minimal, moderate, and severe. And a lot of research in the last, I would say, 2 decades has shown that it poorly correlates with infertility and pelvic pain, what you just mentioned as the two largest comorbidities associated with endometriosis. So in the last really couple of years, researchers are starting to say, well, is there some other way that we can look at endometriosis besides the staging system? And that's, as you explained, looking at the typology of endometriosis. And so what we wanted to do was to extend beyond infertility and pelvic pain to see how do these different subtypes of endometriosis impact risk of not only ovarian cancer overall, but by ovarian cancer histotypes. And that you need a big population in order to study, given the rarity of ovarian cancer. And so this is something that we had access to via the Utah Population Database, including individuals of over 11 million individuals in our database. So this was kind of a nice database to look at this subtypes of endometriosis by histotypes of ovarian cancer.
That's fantastic. Well, let's get into what exactly you did in this analysis. Could you briefly describe the high points of your approach?
So, as I mentioned, we have this large database, linked vital records, EHR or medical records, and we do have the Utah Cancer Registry that is also linked. And so what we did is kind of in a wide net approach, identified over 80,000 individuals with endometriosis diagnosis. And we were able to, through the linked records, particularly the Utah Cancer Registry, identify their outcome, which was these histotypes of ovarian cancer. So ovarian cancer overall, and then by the various histotypes. One thing, when you have a big population like this, we have over 2.5 million at-risk individuals. For efficiency reasons, we took and matched those individuals. So approximately these 80,000 individuals with endometriosis were matched 5-to-1 to those individuals without endometriosis. And then we followed them. On average age, the individuals were 33 years of age, and we followed them on average for 7 years. But all total, our study started in 1992 and went through 2020. So we had, close to 20 years of follow-up period.
Well, that's a wonderful resource for this kind of analysis. Please tell our listeners what you found.
So we found that overall, individuals with endometriosis compared to without had a 4-fold higher risk of ovarian cancer. But then what was interesting is when we dialed into the subtypes, we found that that risk was almost double, so about 8-fold higher risk for type 1 ovarian cancer. Type 1 ovarian cancer includes endometrioid, clear cell mucinous, and low-grade serous subtypes. And so this was much higher than for type 2, which includes high-grade serous, which is about 2-fold increased risk if you just look at type 2. So that was endometriosis overall. But then more dramatically, we found that especially if you were looking at deep infiltrating endometriosis or endometriomas, were associated with close to a 20-fold higher risk if you were looking at specifically endometriomas or deep infiltrating and risk of type 1 ovarian cancer.
Well, this clearly could have some clinical implications, and without causing affected individuals to be concerned enough to have surgery or remove their organs prematurely, since there are consequences for that as well. Clearly, there are consequences, especially people who have completed their family and are still struggling with symptomatic disease. Can you summarize some of the clinical recommendations or implications of this study?
Yeah, so I think there's been some really good research done lately showing that hysterectomies with or without oophorectomies or removal of the ovaries can increase an individual's risk for cardiovascular disease later in life. And this is an important consideration, especially given that we know heart disease is one of the number one killers for all individuals, men and women. At the same time, I think, just as we learned in the hormone replacement therapy, the trials, the observational studies, that you can't, a blanket recommendation for all individuals is not necessarily the right approach. Precision medicine, which is growing in importance, is not just genetics. There are also clinical features. And so we believe that particularly something like endometriosis, which has, for at least the last decade, been known to be associated with ovarian cancer, bringing in the typology of endometriosis. And as an epidemiologist, you rarely see with fairly tight confidence intervals, 19-fold, close to 20-fold higher risk for an outcome. So in the shared decision-making between an individual and their care provider, I think this is something that should potentially be taken into account when she's thinking about either prophylactic surgery or other types of at least closer surveillance, possibly through time.
Well, the surveillance issue is important, and it may be that this may open some avenues for effective identification of higher risk populations that would benefit from screening. As we both know, ovarian cancer screening has not had the yield that we hoped it would, and it's very difficult to screen effectively for ovarian cancer, but perhaps in a higher risk population, there would be a more effective technique. Could you comment on that?
Yes, one interesting, there appears to be genetic differences between type 1 and type 2 ovarian cancer, where actually the BRCA gene, which is not necessarily found to be higher in women with endometriosis, similarly, is more associated with the type 2 ovarian high-grade serous cancers. So, there are multiple different, I think, clinical and genetic factors that could go into some risk prediction model that might help to inform patients and their providers as to the best course of treatment. Interesting enough, certain oral contraceptives have been shown to potentially be protective for endometriosis, at least some of the symptoms, as well as ovarian cancer. But one of the other common therapeutics for endometriosis is ablation or excision of the lesions, and that's had mixed findings in regards to its relationship to ovarian cancer. So obviously there's more research needed in this area.
Absolutely, and it's all about finding the balance for an individual who's affected with endometriosis and finding the right balance of treatment options to preserve and optimize overall health. Well, this has been very fascinating. We very much appreciate you sharing this evidence, and we look forward to your continuing work. I am Dr. Linda Brubaker, and I've been speaking with Dr. Karen Schliep about the relationship between endometriosis and ovarian cancer. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.